There's a particular type of dementia called vascular dementia. It's the second most common form of dementia behind Alzheimer's. The human brain uses approximately 15% of the body's oxygenated blood, and the brain is highly susceptible to any restriction in the supply of this oxygenated blood. As the name vascular dementia implies, damage to the blood vessels supplying blood to the brain can cause damage to the brain itself, resulting in impaired function and hence dementia. It's of course a little bit more complicated than that. The specific type of dementia that occurs also depends where in the brain the damage or blockage of the blood vessel actually occurs. And whilst vascular dementia is far more common in pensioners than it is the rest of society, being young doesn't exempt you from the possibility of it happening to you. There are two main reasons why blood flow to the brain may be interrupted. Firstly, a stroke is where the blood vessels in the brain become constricted, then a blood clot is caught in the narrow gap between and blocks the flow of blood through the vessel, leading to oxygen starvation in the surrounding area. This can be made worse if the pressure then builds up in the vessel, causing the blood vessel wall to rupture, then bleeding occur into the actual brain itself. The other is that deep within the brain, below the cortex, the blood vessels are actually very small and narrow. If the walls become thick or twisted, then blood flow to that region of the brain can become restricted without the need for any kind of blood clot to actually form. Unlike Alzheimer's disease, where memory loss is the primary symptom of the disease, in vascular dementia it's more the ability to think and process the information that's affected. Some things like organising and planning, problem solving, or being less fluent in the use of language or eye-hand coordination. Now, along with these can also be things like mood swings, even aggression and hallucinations. And whilst age is a major factor in vascular dementia, taking steps to reduce either the blood clots forming inside the blood vessels or the blood vessels narrowing can significantly reduce the risk of vascular dementia or its severity when it actually does occur. So some drugs and medicines can do this. Thankfully, many of these steps are also those that we commonly associate with living a healthy lifestyle, especially those with reducing blood pressure. These include things like eating healthily, not being overweight, not smoking, low alcohol consumption, and taking regular exercise. That was the good news. Unfortunately, the bad news is also quite grim. Life expectancy after being diagnosed with vascular dementia is only about 4 years, nearly half that of someone with Alzheimer's. Now, some of this relates generally to the age of the people being diagnosed. However, vascular dementia also only gets worse with time. The more and more of the brain being affected, people lose more and more of the ability to operate and function normally. And whilst vascular dementia is unlikely to kill people by itself, a person may suffer more strokes from pneumonia and other complications relating to the dementia itself. Now, there are some other steps that possibly can either reduce the chances of getting vascular dementia or reduce its severity. These haven't yet been conclusively proven. These include things being like mentally active throughout your entire life, also being socially active, and lowering cholesterol levels and increasing the levels of acetylcholine. That's a brief look at vascular dementia. If you notice the symptoms, especially in elderly relatives or friends, probably best to get them to see some kind of medical professional as soon as possible so they can see if they can get any treatment for it.